I'd like to thank Senator Scott and Senator Casey for their work on anti-discrimination legislation, particularly as it relates to anti-Semitism. I support them in that effort and look forward to getting something done here in Congress to help address the definition at the Department of Education. But, Mr. President, I rise today on another topic that is affecting every single state represented here in this chamber, and that is the opioid epidemic. This is heroin, prescription drugs, increasingly these synthetic heroines that are coming into our states, poisoning the people we represent, leading to a situation where we have about 120 people dying every day of overdoses, about 5 a day in my home state of Ohio. Unfortunately, I have to report today that it's getting worse, not better. I also believe that Congress is beginning to take the right steps to address that, and that's what I want to talk about today. This is, I think, the 28th time I've taken to the floor this year to talk about this issue because it is one that affects every state, but particularly mine. I come from Ohio. It's a state that recently, based on a new report that's out, was named as one of the top states in the country in terms of overdoses and, unfortunately, again, the tragedy of overdose deaths. Those who die from overdoses is, of course, a tragedy, but frankly, it's just the tip of the iceberg because there are so many people whose lives are shattered, whose families are torn apart, who aren't going to work, whose communities are facing more and more crime because of this issue. So it's addressed here in this chamber recently by legislation I want to talk about today, but it's something that we must find a way to deal with and do with immediately because of the urgency of the problem. This is much like, to me, other public health crises that we face as a country, whether it's the Zika virus or whether it's other issues that have come up where Congress has said that we need to have immediate funding, immediate changes in policies to address. What Congress has done already, and the President has signed into law as of a couple of months ago, is broad legislation called CARA, Comprehensive Addiction and Recovery Act. And that legislation is historic in the sense that it's the first time in over 20 years Congress has taken a look at this issue and come up with a comprehensive approach. It focuses on education and prevention to help people make the right decision and not get into the funnel of addiction, particularly focusing on young people. But it also focuses on better treatment services and recovery. Right now, there are people who cannot access treatment, and part of the problem is there's not adequate funding for that treatment. Part of the problem is there's a stigma attached to addiction, and people aren't willing to come forward. And our legislation, broadly speaking, addresses that as well, because it says that addiction is a disease and ought to be treated as such, which will help to get people into treatment. Longer-term recovery. For the first time, Congress is supporting not just treatment and detox, but actually getting people into longer-term recovery programs. Think of sober housing arrangements or other supportive services, recovery services that we found from our experience and doing the research around the country is much more successful in terms of helping people turn their lives around and lead a productive life. What we have found in the last 3 years with 5 conferences here in Washington, D.C., bringing the experts in from all over the country, is that this is something that could actually help to turn the tide, to have this longer-term recovery focused on. So again, it's the first time Congress has focused on that. We also focus on this issue of ensuring that the law enforcement community and the first responders, our firefighters and others, have access to this miracle drug called Narcan or naloxone, which is able to reverse the effects of an overdose. So there is a program to allow them to apply to get the Narcan that they need to be able to help save lives. And again, it's amazing. It was administered 16,000 times in Ohio last year. This year, it'll be a lot more than that. Those are lives that are saved. It's not the ultimate solution. The solution is getting people into the treatment and recovery that they need, but it is necessary right now given the epidemic that we face. And there are other aspects of the legislation as well that help to ensure that we get the prescription drugs off people's shelves that unfortunately are being abused by having more drug take-back programs, that we provide for more resources to ensure that people can get the help that they need in terms of treatment and recovery. I am happy to say that the legislation is beginning to be implemented. I would ask the administration again today to expedite that implementation. Of the 7 larger programs that are part of this legislation, I think it's fair to say that 2 are being implemented at this point already, and we need to move forward with others as well. I know it takes a while, and we need to be sure the programs are properly implemented. But again, there needs to be an urgency about this issue. Section 303 of the legislation is being implemented now by the Department of Health and Human Services as one example. It expands access to medicated assisted treatment by allowing nurse practitioners and physician assistants to prescribe medicated assisted treatment to help treat an opioid use disorder. This is important. Back in my home state, I'm hearing a lot from people who are already training people up to be able to provide this assistance to those who are addicted and need to have this medicated assisted treatment. This could be methadone, it could be Suboxone, it could be Vivitrol. But to be able to allow nurse practitioners and PAs, physician assistants, to participate in this is incredibly important. So this is progress, but we're pushing the administration to implement the law even more quickly. CARE also deals with the growing demand for drugs, as I said, by improving access to longer-term recovery. Recently, I was able to go to a recovery house in Canton, Ohio, Phoenix Recovery Home, and was able to talk directly to some of the recovering addicts there who had been through treatment, in one case several times, where it had not been successful, but this longer-term recovery was working for them. Again, a reason that this legislation is so important, and we need to implement the recovery aspect of it. The funding for this has been also a work in progress. We've made some progress toward increasing the funding. This year, there's about a 47% increase in funding for opioids. In the legislation, CARA, there's an authorization. In other words, funding is authorized for an additional $181 million every single year, and that's important. That $181 million every year going forward is something that will be important with this comprehensive approach. But in the short term, and we're working under a short-term spending bill right now called the Continuing Resolution, we were able to get funding in $37 million that expires next week. We've got to be sure that that funding continues. That's adequate funding to implement the program now, but we need to ensure that we have short-term funding over the next period of time, whatever that is. Some say it'll be from now until March, to ensure we continue to keep CARA implemented. What I'm pleased to report today is the 21st Century Cures legislation, which the House has now sent over to the Senate, includes a dramatic increase in funding for this issue. It's about a $500 million per year over the next 2-year additional funding. These will be block grants to states for prevention, for treatment. This is incredibly important to my state of Ohio and other states. My understanding is that states that have a higher prevalence of overdose will be given a priority in terms of these funding dollars. Again, I think that's appropriate and will be very helpful to those states that have been hardest hit. I do wish that some of the parameters of the funding instructions had been a little broader to include this issue we talked about earlier of recovery services. So treatment, incredibly important, but also this longer-term recovery aspect. But we're working to ensure that as this is implemented, that the states have maximum flexibility to be able to address this problem. This legislation will be bipartisan. I think you'll see the vote to be very bipartisan next week when we take it up, and in part it's because of this legislation. So between CARA and between this new legislation that's in the Cures Act, we are going to see additional funding, and it's urgent that we see it. The Kaiser Family Foundation recently released a report based on information from the Center for Disease Control and Prevention. It found that 1 in 9 heroin deaths across the United States happen in our home state of Ohio. We had the most deaths from synthetic opioids like fentanyl and carfentanil. This is the synthetic heroin that's coming into our communities. Unfortunately, we're seeing an increase not just in Ohio, but in other states around the country. And every day, I hear from this issue from Ohioans. Sometimes when I'm back home at events that have nothing to do with this substance abuse issue, people will come up to me, as they will this weekend, I'm sure, and talk about their personal stories. Recently, I received a couple of letters that I want to mention just before Thanksgiving. I got a letter from Elaine. She is from Cincinnati, Ohio, my hometown. She wrote that her daughter was lost to a drug overdose in 2013, her grandson from a drug overdose August 1st of this year. Now she has another son who's an active heroin addict. She went through this story where she's been trying to get him into a detox center and treatment, but she faced certain barriers. One of those barriers in her case was being able to afford it. The insurance initially would not cover it. We're trying to help her in that, but meanwhile she's at wit's end, trying to ensure that she can do something now to save her son's life, having lost 2 other members of her family. Again, This legislation that we're going to vote on early next week, the Cures Act, will help with regard to Elaine's inability to find detox and treatment for her son. Barbara in Columbus has been in touch with my office a lot. She lost her son Eric to an overdose in 2012. He was just shy of his 24th birthday. She writes that Eric wanted to go to rehab. His sister took him to every place in Columbus. No one had room. There was no room at the inn. And this is another issue that we're finding around the country, is that sometimes these resources are available, particularly in larger urban areas, but frankly, they are overprescribed oversubscribed given the issue of heroin and prescription drug addiction and the growing problem that we have. She writes, and I quote, "We need to stop jailing people for drug use. We need to stop people from dying on the streets. We need to get them into treatment clinics. We need to recognize the difference between drug use and drug abuse. We need to focus on creating a society where people don't feel the need to numb the pain of their existence through drug abuse." I agree with her, and that's, again, is part of the focus of the Comprehensive Addiction and Recovery Act. Ask for 30 additional seconds. Unanimous consent.
Is there objection? Without objection.
Mr. President, again, I am pleased that Congress has made so much progress in this area. I see my colleague from the Judiciary Committee is here, Senator Leahy, who helped get this legislation through his committee along with Senator Grassley, called the Comprehensive Addiction and Recovery Act. Now we have a chance with the Cures Act to put even more funding immediately against this problem. I encourage my colleagues to support that legislation. It's good legislation for other reasons as well, but also because of the fact that this epidemic of opioid abuse must be addressed.